Good day everyone. Today guys, I just want you to meet a new member of our family. I want you guys to meet Baby Dot. Before you guys comment or congratulate anything like that, please wait until the end of the video, okay? I do have some more info about this pregnancy. So in this video, we'll be discussing our struggles and difficulty having a baby here in the United States and some emergency situations during these pregnancy situations, and as well as things that you do when you find out you're pregnant here in the US. So with that, let's start. Me and my wife had difficulty having a baby when we arrived here in the United States. Before, we had to wait until we had enough budget in order to start making a family. Why? Because when we moved here in the United States, I was only under a staffing agency and my wife didn't have work at that time. She was still reviewing for NCLEX. And during that time, the expenses were okay, but my salary rate was under a staffing agency, so it wasn't definitely enough. Or maybe it was, but I just didn't want to gamble having not enough funds before we have our first baby. We wanted to give more likely our best for that particular fetus or baby. So we decided to wait on. And then when we were trying, we were having difficulties. So we decided to approach some of medical doctors, and fortunately for us, we were able to conceive this baby in our term. It took us like 2 doses of a letrozole. Letrozole is kind of medication that helps you ovulate, then helps you have a chance to better procreate during those particular times. So fortunately for us, it only took like 2 cycles. Okay, so my wife started having the symptoms when she was back home in the Philippines during our vacation. Her symptoms was, number 1, her breast tenderness. It's like really like super tender. Like a little bit of touch, she would like really be in pain. And another thing is the nausea, some mild nausea on and off. And I think she did vomit a few times, but not really like a lot of vomit too, like just like a regurgitation type. Then weakness, or more of like a fatigue. She really looked like super sleepy all the time, and she slept like maybe 12 to 14 hours, and she still feels sleepy at the time. So when we were in the Philippines, we tested to make sure if she was pregnant or not. Unfortunately, the test came back negative, so it's like we just brushed it off. But when we came back here in the United States after our vacation, her symptoms like kind of gotten worse. So we had some strips here, guys. We call this an ovulation strip and a pregnancy strip. So we used ovulation strip when we were trying to conceive our baby, and it turned out it was positive. Then also with the pregnancy test, it also turned out positive. So it was kind of like an unofficial way of saying that my wife is pregnant. So we are having a baby soon. Yay! So we were super excited with this, but my wife was still in doubt that she was really pregnant because it was just a strip. So she said maybe this is like a false positive or something. So we decided to buy an official pregnancy test, and we bought the slightly more expensive one. It's a $9 pregnancy kit, and it has like 2 kits in it. So, and it's a digital one. So when we tried the following day, it turns out she is pregnant. Yeah, it says there it is. See? Pregnant. And my wife is, she might look shocked, but she's happy. And if you see this baby bump, this is not hers. That's mine. It's been there for 3 years. So after finding out this pregnancy test, my wife was still like not really sure about this pregnancy. Like she's still having doubts that if she is really pregnant. I guess that is normal for most women, especially on their first pregnancy. So she bought something online. She wanted to check how many weeks our baby is. So there's a particular test, and it's the same brand. It's clear blue, and she actually ordered it from an Amazon, and it came from Mexico. So here, and the result showed embarazada 3+. So there's like a scale on this particular kit that says how many weeks you are. So here, for this result, I think it says like more than 5 weeks. If you did the math, it does look like it's more than 5 weeks. So it is kind of more assuring, like more info to say that my wife is pregnant. So we were really excited and happy during this time. So because finally, after like maybe like 2+ years, my wife is finally pregnant now. During this time, I really wanted to tell the whole world that my wife is pregnant and we were having a baby soon. But we have like what we call a pamahiin, or a belief back home in the Philippines, wherein you're not supposed to tell anyone until you're like after the 3rd trimester, or not the 3rd trimester. I mean the 3rd month or the 1st trimester. So that's kind of like how we have a belief back in the Philippines. So we didn't tell anyone. we wanted to tell her mom, my dad, but said we just keep it first. Both our parents have been asking for a baby ever since we got married. So that's how pushy they are when it comes to us having a baby. So finally, we have a good news, but we can't share it that moment because of this particular pamain. She did share some of these things with some of her close friends. And actually, one of her close friends, Beshi, actually reached out to us first. And she told us that she was also pregnant. So we were super excited, more happy during this time because my wife has someone to go during this journey with someone close. So it was kind of nice knowing that. So we were both excited and happy that maybe in the future, both of our kids can be playmates or something else in the future. So yeah. So with that, we were both excited with how things are playing out for our lives. So during these times, my wife's symptoms like gotten worse, and she looked like more fatigued. So being this our first baby, we decided to let her like quit her job and just let her rest. Another reason why I wanted her to quit her job because most of the patients that we've been having in our particular floor are alcoholic or having withdrawal symptoms. So it wasn't safe for her. So a day before she resigned, some of the patients kicked one of our staff in his belly. So kicking super hard, and I can't imagine if that happened to my wife. So it was kind of like a time just to let her rest and let her quit her job for now, just temporarily until she gets the symptoms controlled. And also, after we got pregnant, we tried to schedule an OB appointment as soon as we could. Unfortunately, the OB that we wanted, per recommendations for some of our friends here in Louisville, we couldn't see her not until like 4 or 5 months. So which was like too far away. So we just asked them to provide us with OB-GYN who has a nearest schedule. And I think here in Louisville, they wanted to schedule people like after the 3rd month of your pregnancy. So that's how they usually do things here, which is really unfortunate and has some bearing with my story later on. So I think for us, it was okay. So I don't think we can do anything about it. And good thing we are both nurses and we have some medical backgrounds and some idea of how pregnancy goes about when it comes to like a healthcare thing. So we thought. Also, when you register with a particular OB-GYN, they'll ask you to log on into the app and ask you to put some details. And one of the nurses called us, asked her some questions for past medical history. So we put it in and we have those things set up in our app. And if you see in the app here, it says, my wife is due on March 8, 2024, and she's on a 10th week pregnancy during this time. This was not taken when the time we called in. This was taken like on her 10th week period. So we just took a screenshot of this. We actually forgot to take this initial picture or screenshot. So anyway, on her 10th month period, we were planning to get an ultrasound result. One reason is because we just wanted to see our baby if she's really there. So my wife was still in denial in a way. So she just wanted to make sure that it's there. Also, we needed a picture because we were planning to surprise her mom on the 11th week of her pregnancy. It's her birthday. So we were planning to surprise her with a money cake wherein you pull the money, and at the end of the money trail, you can find a picture of her ultrasound saying, "Hi Lola" or "Hi Grandma." So we really wanted to surprise her that way on her birthday because I think this would be a really, really nice gift for her since she's been asking since we got married. Okay, so we really wanted to do that. And another reason is also because I think during this time, my wife suddenly have like a staining of blood on her pad or like a tissue when she was wiping. So when we were doing the research on Google and everything, it says it's okay. Yeah, having some super light staining and as long as not like a soak pad, then that is kind of normal for the first trimester. So we were saying like, okay, we'll just brush it off and we'll just wait for the ultrasound and see how it goes. We decided to book to the ultrasound. Per recommendations, they only want to get this kind of ultrasound from 10 weeks to 12 weeks above period in order for them to get a proper heartbeat. So this is what they recommended. So for us, like I said, we just wanted a picture and make sure it's there. So we just went through. And I think 10th month was kind of okay. I think they might be able to hear the heartbeat with transabdominal ultrasound kind of thing. So we booked this with Sweet Baby Face Ultrasound. It's located in Louisville as well. So we paid like out of pocket. So what they do here, if it's your scheduled appointment, they'll ask you to come into a particular room and ask you to choose a specific stuffed toy that you would like. Because with the heartbeat, they'll get the heartbeat sound and they'll put in a small device and stuff it in a stuffed toy in order for you to be able to hear that heart sound, or you have something like a memory or something like something to cherish during this time from that particular experience. It was kind of a nice touch with this particular journey. So for my wife was hoping our pregnancy to be a boy, so she chose a monkey. A monkey is kind of like a junior for daddy. Daddy is termed as a monkey and mommy is like a panda. So so mommy wanted to have another small monkey in our family first. So for me, I wanted a panda. So either way it works. Then during this time, my wife was like sat on the table and I was like directed to be on the big screen TV so I can view it better. So during this time, it was kind of like a nerve-wracking and like really anxious kind of experience, and super happy when I saw this small round thing and they placed in a baby. Yay! So this was the first time we ever saw our baby thought in 2D picture kind of thing. So it was kind of exciting. So we were really happy to see this. Unfortunately, during this time, the tech was having a hard time getting a heartbeat. She said it's too small, and she told us the size doesn't look like it's really a 10-week-old baby. She said most likely it's like a 7 to 8 week kind of size of the baby. So for us, it's like maybe we just made a mistake with the computation. So that's what our initial thinking was. So we decided, okay, it's okay. And she said the heartbeat could not be auscultated if it's not above like 8 weeks to 10 weeks to 12 weeks. So she said maybe it's too little, the heartbeat may be too faint to be heard during the trans-abdominal ultrasound. She said it might be better to get a heartbeat via a transvaginal ultrasound. So I said, okay. So I'm fine with that. I'm just happy that my baby is there and it's not on the fallopian tube or somewhere that can cause like an ectopic kind of pregnancy. So for me, I was kind of sort of relieved during this time. Unfortunately, my wife was feeling something else. My wife felt more anxious about the situation as a result of this ultrasound. She felt like it really couldn't be like a 7-week or to 8-week pregnancy because she was sure it was like a 10-week period. And of course, we did our computations when we had the letrozole medication. I said, okay, never mind. We'll just wait and let's just call the OB the following day, on the following morning. It was a Saturday on that morning if we wanted to call. So, when we got home, my wife had another episode wherein she was wearing a pad and she had more like a blood stain. But it wasn't kind of soaked. It's just like a smear on the edge of her pad. So, it was darker than the first one she had the earlier day. So, it's like, okay, okay, just like a small pad. It's like per Google, it's not soaked, so it's still okay. So we will just call our OB in the following day if we could. So that was our initial plan. So during that night, we just slept and rest, and we were planning to see the OB the following day. Unfortunately, at 6:30 a.m., my wife like suddenly woke me up, and she was really crying and being hysterical. On the bathroom, when she tried to pee, blood clot came off her. It was kind of like 1 inch by 2 inches long. So both of us were new to this. Though we thought we were nurses, we knew what we were expecting. But it's quite different if you're in that particular situation. So we were really less scared as hell. Like super duper. So we were both worried. My wife was really like crying, and I tried to be brave. I tried not to cry. Just wait. Let's just check. And as per Google again, Google says it's normal to have some clots coming out from your system during your first trimester of your pregnancy. So we said, okay, I think per Google is still okay. So that kind of gave us a little bit of relief. So we just wanted to make sure and decided to call our OB or try to go to an urgent care. Urgent care is kind of like before the ER. It's kind of like not an emergent kind of cases, but you really have to go and see a doctor. Because during this time, my wife didn't have any symptoms other than the blood clot. that. She didn't have any cramping, didn't have any pain, no other kind of symptoms. We tried calling different kind of urgent cares. Unfortunately, they were closed during this time because it was like 6:30 in the morning. Fortunately, there was one who was opening soon at 7. So when we called her, she said this kind of like an emergency room kind of admission. So she told us to go immediately to ER. So we went to the nearest ER, which is like 5 minutes from our place, and she was admitted to the particular ER just to have her monitored. And they were planning to do some tests and to do a vaginal ultrasound during that time. Unfortunately, during this time, when my wife had more bleeding, it's the first time she had more bleeding come out. So that made us really scared. So during this time, we were really scared. We were kind of hoping our baby's still okay, hoping that everything will be fine. But this happened.